It's a new one.
Oh, okay. Sure.
She wants me to start. You want to take this piece?
Which one?
The patient has been evaluated.
Where's that? Oh, it has been evaluated there.
Yeah, that's where you'll start. Is that okay? She
Sure,
wants me to-
sure.
Okay. And then you can talk.
Oh, okay.
Just tell your story.
I will, I will.
Okay, everybody's ready? Ready? Everybody's ready? Okay, here we go. The Department of Public Health and Social Services is very well aware of rumors that have been circulating in social media, including chat groups. And we're here today with the experts and our team to provide you the adequate and accurate information of what transpired and to also let you know the outcome of this rumor. And I'd like to start with our epidemiologist, Dr. Ann Pavitsky.
Yes, there are currently no cases, no confirmed cases of novel coronavirus on Guam. We are continuing to see a lot of influenza and colds, but it's flu season. We normally see that at this time of the year. Local news outlets have recently reported that there was a patient on Guam that may require isolation due to a possible coronavirus infection. This patient sought treatment at a private medical clinic, and we received a call from that clinic on our Warren phone. And this is because there are established protocols in place for reporting of infectious diseases of public health significance to the Department of Health. We get daily reports on such illnesses, including influenza, sexually transmitted diseases, etc. We received very little information about this patient because we weren't able to contact this patient over the phone. But we finally were able to contact the patient this morning, and the patient was asked to get a prompt medical evaluation.
Patient was fully evaluated by a Guam provider, had a complete history and physical, checked out, and the provider even consulted with the Centers of Disease Control because of the situation that we've encountered, just to be on the safe side, and he was cleared, and he was not a person of interest, not a patient under investigation, and so the case was closed, and other reasons for the illness that the patient has are being investigated.
So he's not a traveler? He hasn't recently traveled on island?
No.
When you say he's cleared, can you explain what you mean by that?
When we say clear, what are we looking for? Right now, we're looking for potential cases of coronavirus and trying to identify any suspect patients under investigation. And so when we have someone who may have indications that they need to be evaluated for that, they're evaluated for that. You're going to have, as with any respiratory illness, you're going to have the same symptoms, cough, fever. So if we get that these days, we're always thinking, is it a PUI, a patient under investigation? Once we cleared that, then we got to really get down to work and figure out why the person has a cough. So two things happen, and so when we say cleared, we shove that aside and move on to business.
So I'm just trying to understand how you can rule out coronavirus. Can you explain that?
Well, how do you rule it in? They have to have risk factors. If they don't even meet the risk factors,
Right.
no travel. How do you define a patient under investigation? Symptoms plus exposure to coronavirus, or exposure to a patient with coronavirus, or recent travel to China. It's how you rule it in, and the patient didn't even meet that criteria.
Well, we had heard, and I don't know how truthful it is, but we had heard that the patient is married to a Chinese Chinese woman who had just recently returned from Beijing and then has subsequently departed back to China. Had you heard that same thing, or?
Rest assured, the provider investigated everything. So I can't address what you heard. You're the best one to say what you heard, but I can tell you this, the provider assessed everything and
Can you go
found
through
that
a
didn't meet
checklist?
criteria.
Sorry, can you just go through a checklist with us, what those criteria are that you do?
There's CDC guidelines, you can find it on the CDC webpage for coronavirus. And there's very specific criteria for symptoms or clinical, presentation, and then epidemiological risk which would be travel to Wuhan, China, or close contact with a patient who was confirmed with coronavirus. These
And you
these
guys
people
are
did,
confident that the provider did ask, going back to Nestor's.
And
Yes.
consulted with
Yes.
CDC, yes.
yes,
That,
So CDC even backed that up, yes.
Yes.
but the provider, you're confident that the provider asked the question, did your spouse or anyone in your family?
It was not just the
recently
provider.
travel?
The provider also was in concert with CDC. So everyone was involved on
Yeah, so
this.
just to be clear, you're saying now that he is not married to a Chinese who had just returned from Beijing?
I'm not commenting on his marital status.
No,
No, I'm
but-
not.
But the story
I
is-
can't comment on hearsay. I can comment on the
Can you say if
facts.
it's true or not?
I can't comment, no, not on any of that. I don't know his marital status or where she went. I can tell you the
Well,
provider looked at.
How can you be reassured then that he didn't, if you can't even say yes or no to that?
I wasn't the provider. The provider can assure that,
So the provider assured you.
and the CDC.
yes,
Yes.
this morning.
That story is not correct.
Absolutely.
Right.
Well, doesn't meet criteria. I don't know about the particulars of that. The provider is aware of all those things, and I don't really want to comment on that because the provider got all those details and consulted with CDC.
Okay, I still don't
Did
feel
everyone from
public
public
that.
health-
I mean, that you guys
They
don't-
did their work. They
Yeah.
did their work and decided it didn't meet
But
criteria.
you guys can't say now that story is true or false, because if it's true, then that would mean that it would fall under the criteria, correct?
Well,
Because he was in contact
If
with
that's the
someone that
case,
had
then the
been in China.
provider would have known that. And the provider would have been responsible for that, and the provider would have addressed that. So I would have to say the provider ruled that out. I wasn't there, so I would have to say the provider ruled it out in concert with the CDC.
But you asked him about it.
Yes, Dr. Thane Hancock did ask them about that, and Dr. Thane Hancock did speak also with the provider, and all that information was relayed to him. And yes, he confirmed that.
So when you have these possible cases that kind of blip up on the radar, is there anyone from public health that actually goes out and speaks with the patient directly? Or are you relying on the provider to follow those guidelines set by the
Sometimes
CDC?
both,
But in this case, it was just the provider.
several providers.
No, the
But
Department
not
of Public,
was public health
Yes.
part of that
Yes.
Yes,
conversation
yes,
with the
yes,
patient?
yes.
Yes,
part of our role with public health is to do surveillance and response measures. So with any reportable disease, and now with the novel coronavirus, when a provider, or even at the ports of entries, as you reported a few days ago that we were at the airport, we are notified. We send out a response team that includes a public health nurse, as well as a communicable disease control staff. We do our investigation. We obtain guidance from our medical director or other designated physician. We consult with CDC, and based on the clinical criteria that's provided by CDC and additional guidance, then we determine, is this individual a person under investigation? And so the report and the response, regardless if it's at the ports of entry, at a private physician, or even at a hospital or a public physician, public health is part of that investigation and response.
And we
So
won't be
did public
contacted.
health speak to this person this morning?
I did, yes.
Yes.
And
You spoke
after
to the
talking
patient.
to this person and finding out their story, we suggested that this person get a prompt medical evaluation. And they did.
And you're going to have patients in the community who seek medical advice and don't meet criteria, and we won't be contacted for everyone with a cough that comes in,
That's
because
right.
most usually it's going to be the flu. And so they're not going to call us and clear all that with us. They are going to look at the CDC guidelines, read those and go, okay, no, 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 and then we won't get called. Now, if it's yes, 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 we're very definitely called. We're the next step. So we will get called on those.
How many, or have there been any cases that have been sent off to CDC for testing?
None.
None. So you have not come across any patient here that has even the possibility of having contracted the coronavirus?
That's correct.
At this point in time, no.
Yeah.
That's right.
No. Which is a good thing.
Yep.
We're happy about that.
Yep.
And those 36 passengers who recently flew in, who were identified by the airport officials, are we keeping track of those folks?
Oh, yes. They have forms. All of them went through the rigorous screening at the airport. Annette was there at that time, and our public health nurse. And they did what they had to do, is the clinical assessment and the epidemiological assessment. And in that epidemiological form, they also have the name and contact person, the number, all the information to contact them. And they're also issued, if they're all asymptomatic, they're also issued health alert cards in the event that they should become ill, who to contact. Our Warren phone, like that's the 24/7 phone with Dr. Popitsky. And we also have our CDC staff. That's a 735-7143 number. And so Annette could also further comment on that. She was there.
Yes, we, as part of our protocol within the Department of Public Health, we conduct surveillance. We will monitor for the 14 days, should they be here that long. So again, it was a mix of visitors and residents, and so, yes, we do have that contact information, should we
And you're
need.
actively following up with them periodically throughout the 14 days?
Yes,
And then how frequent is the surveillance? Is it
daily surveillance.
Daily.
And what does that entail? A phone call or a visit, or what is it?
Depending on the individual situation, we can do face-to-face daily surveillance, or it can be a phone check.
And what have you done with these 36 or so?
We've done a combination of both.
Do the hotels that they're staying at know that they have these visitors?
All the hotel knows is they get an information card, and they if anybody calls downstairs at the front desk, they will provide them that information that they need to know. Rest assured that the patients that are coming out from the airport, the travelers, also should have that card. But that's another backup layer in the event that they do get sick and let's say they lose their card. That's what's happening at that point.
Should a person be quarantined and isolated? Where are these isolation centers, and are there proper resources to actually, for these patients, and also for maybe the public?
Okay, I'll let Jana answer the part about the isolation and quarantine, and then I'll answer the question about the isolation capacity. Okay, Jana?
If someone, well, the flights from China now are diverted, so we don't have those coming here. Those go to the 11 airports that have been identified. Honolulu would be the next step. And if they feel like a person needs to be quarantined, they quarantine them there. Otherwise, if they meet criteria and they're fine, they can send them back here for self-isolation and quarantine for another 14 days, and they will notify us that they have passengers that meet that criteria. And actually, these patients came in before the ban, but
And none
in
of
the
them were
abundance of
ill.
precaution,
That's the
yeah.
other thing to remember. None of these people who came in from China the day before the ban were ill. They were given a card in case they become ill to contact. So,
Right. The concern is that many of the people who have been confirmed outside of China
Yeah.
were asymptomatic.
Yeah.
So I think
That's
that's
correct.
where
I wanna
I don't
make-
know about the other media
Yeah.
No.
organizations,
Yeah.
but that was the concern that was raised by a bunch of our readers.
Right. I was on a call this morning with ASTO, the Association of State and Territorial Health Officials, which combines all public health directors. That case with Germany, what was missing in this picture was they didn't know that this person that had a meeting, she had the fever, and she took medication to bring down her fever before she had a meeting with that gentleman from Germany. And they found out through lots of investigation that she already exhibits signs and symptoms during that meeting when it was being done. So they're trying to let us know that it's not being asymptomatic like the way it's portrayed in the beginning. They're finding out through lots of investigations of all the cases that they're studying and they're reviewing it was that she did exhibit symptoms of fever, and she did, she had that close contact with that individual, that business person from Germany. And before, when this whole thing started, they didn't have that detailed information because there was further investigation that was done on this particular case. And so what they were telling us this morning on that conference call was that she was symptomatic. So things are, you know, changing, and they're learning a little bit more as they do further investigation. So I want to rest assured that that was very comforting for us to know that, because, you know, it's scary when you don't know if they're asymptomatic, but we're finding out through these studies that are getting very extensive that it's boiling down to symptoms that they're identifying that did exist. She just took an aspirin or a medication, just over the counter, just to bring down her fever. And so that's what happened. So I just want to share that. That's the latest that I have. And we continue, the Department of Public Health, to participate on these conference calls with CDC. Dr. Thane Hancock also has his calls. Our governor also has her calls from the governments, all the governors throughout the community throughout the United States. I have my conference calls as well for the Association of State and Territorial Health Officials, being part of the board of ASTO and also the Director of Public Health. And so I just wanted to share that latest information to hopefully let you know that we're learning and they're learning, and as they tell us, we're informing all of you.
And this case too, the one from today, this case wouldn't have come to our attention at all. We're just showing due diligence because it was all over the media, but this is a case we wouldn't have even received a call on. We just involved everyone because of the attention it had gotten, so we could address this as fully as possible.
Speaking of the reporting system, are you satisfied that is sufficient? The hotline and the call-in to Dr. Kovatsky? And what are you happy with how the physicians or the clinics are reporting these incidents to you?
We would like, I'd like Jana to answer that, and I'll just make a few more comments.
We're happy with it.
Yes.
And we invite the calls, and we do get calls, not very often. Some are misfires, but it's okay. We would rather have the calls than not have the calls. So we invite the calls, and the system's working.
In this particular case, it was said that the initial call did not provide sufficient information so that you weren't able to follow up. So what went wrong there?
No, we did follow up. It's not that we weren't able to follow up. They did follow up. They had to get more information. So Dr. Bobitsky did make the call and communication with a private provider. Go ahead, Doctor.
What's the question?
So you received a call from, I believe, a clinic or a physician, but there was a delay of several hours before you were able to
Get additional information from them.
information. So what, can you elaborate on what happened there and what?
I guess the person had left that private clinic and did not get any treatment. And then they called us. And then we located that person and contacted him and suggested that they go somewhere else for medical evaluation.
Dr. Ryan, can you just walk us through this morning scenario? What time did you guys receive the call?
This morning I called him about 8 a.m., the patient, and talked with him, and we consulted with our medical director, and the suggestion was that the person should go get seen by a doctor because he was coughing.
And when was the red flag raised?
There's never been a red flag. There wasn't one. This case doesn't have a red flag. It's not a smoking gun. It doesn't meet criteria for patient under investigation. We did all of this, shut down public health for 2 hours this morning, and had a press
Right.
conference in response to the community's attention, because what went viral wasn't the virus, but the story. And so we would like to caution people to watch the keyboard, because, you know, and the World Health, you know, cautions that too, and they said that sometimes the stories spread faster than the virus itself. So we're gonna have a lot of these. So.
Yeah, just to reiterate, the rumors and the misinformation can spread faster than the virus itself, and this really can be dangerous. And we understand that the people, all our island people, are worried, but we really must ensure that we're providing clear and timely evidence-based information to the community to respond to their concerns. And because this was a very big issue that everybody had, media, glitz and everything just going out, we do want the public to know that we did our due diligence, we did what we needed to do. We want to also inform the public that we're following our criteria and all that we need to do to ensure that we address and we're on top of things.
And how was the patient located for the follow-up call?
We received an additional phone number from the provider. And it was late enough that I don't remember if the phone wasn't working or nobody answered. We followed up this morning and were able to contact the person.
Yeah.
Out of curiosity, prior to the travel ban that was initiated by the White House a couple days ago, there was a plan that was being created for the eventuality of the coronavirus coming along. Do we have that plan in place?
Absolutely.
Do we have an area at the airport to quarantine?
Yes.
Should someone slip through the net?
Yes.
That's been created?
We already had a plan that we did for the whole island. It's called a pandemic plan that was done
Right.
way back in 2008.
So is there a
And that plan,
quarantine area at
yes,
the
there is
airport?
At the
there is
airport,
a
yes.
quarantine area at the airport that can hold multitude of patients there or travelers there. And that's already in place. And we also have another room that stores all the supplies that we may need, such as masks and gloves and face shields, whatever is necessary. And our nurses are well equipped. They come with their thermometers and their whole bag that is very well equipped for them to do their clinical evaluation. And so that pandemic plan has been in place. And so, of course, all agencies have their own protocols. And as you know, yesterday we had the Guam, the whole, yes, that whole tourism, and also in line with the Guam Hotel Restaurant Association. And they're also notifying them that look at your plan, everybody knows their protocol, let's be prepared, and so forth. So right now, the incident command system of public health will be activated when there is one case of coronavirus. That's our trigger to activate. And that will trigger the whole emergency operations center throughout the government entities to be activated. Right now, we pretty much we don't have a case because of that, but we have already taken measures to pretty much get things moving in that regards, in collaborating also with all the airport and the Customs and Quarantine and the Customs Border Protection or Patrol and all GMH and so forth. We've already done that. We should already be doing that, but when a case occurs, that's what triggers the whole operation center to be activated. But we went before that. Sorry, she has to answer the phone. It could be another case, so excuse us. So anyway, that's the reason why I want to let you know everybody has their protocol, and that's why the pandemic plan is there, because everybody will then implement their portion of their protocol. So I hope that answers your question.
And as far as the patients under investigation, we have a line set up for a patient that walks in and they go, oh, this one meets criteria. And so then they would alert us, and then that sets forth another algorithm. In the meantime, they're going to go ahead and do evaluation on the patient as if it's not that. They're going to evaluate the patient. It's not just a kick and punt over to the CDC. They're going to say, hey, check this out. Now, we're going to get a lot of calls that don't meet the criteria, but they're still scratching their head saying, could this be? We get those calls too, and we're happy to get those calls, because working through it as a team is the best. And then we all learn how everyone thinks, why did this one not count? Why would another one count? And what was missing in this picture, and what available information do we have? And if we don't, I'll tell you this, if we don't have enough information and it looks like it could be, for using the abundance of precaution, we're going to go for it. So we have to feel fairly confident, really confident, to close the chapter on one. So if there's any question or anything loose-ended, the providers will call us and we'll follow up. It's a real team approach, and it's been amazing how everyone has brought all their tools to the table for
And she just wants to say.
I'd
a
like
few
to just
words.
add, in regards to surveillance and response at ports of entry or a healthcare facility, that's a standard procedure that public health has in place with our multi-agency partners. So any fever, any rash-like illness on an ill passenger coming into Guam does not have to be only suspected novel coronavirus. It's any ill passenger.
yeah.
Public health is immediately called by Guam Customs and quarantine. So this is something that's been in place for years. It's not just only in response to the novel coronavirus.
That is correct.
Dr. Ann, was that a case?
No. No.
So she sometimes, gets all these
We
calls.
get other kinds of
Anyway,
calls,
Yeah,
too.
lots of calls. I just want to remind the community that we really need to come together as a community as well in order to share information. And it's very important that everyone ensure HIPAA compliancy and guidelines of patient information to be shared. And what you all can do for us is really spread out the word of prevention. The layers of prevention to prevent this virus from further spreading are 3 layers of prevention. Number 1, the healthcare provider has to be the key to notify us when everyone goes to different clinics. They're the key to provide that information to us. The second layer, of course, is infection control, ensuring that their areas provide the best protection so to prevent this virus from spreading within their own clinics. And third, for the public to be continuously educated on cough etiquette and hand washing techniques. And what I mean by that is if they cough, you cover your mouth with a tissue, you discard the tissue in a receptacle, you wash your hands. Frequent hand washing all the time for at least 20 seconds is going to do wonders to prevent all these any type of virus from being in your hand. They can't enter into your cell until you touch your mouth or touch yourself. And so we also want to emphasize that these things, or cleaning out your surface, whether you're at the clinic or at home, to prevent any virus from growing and being there. We also want to emphasize that we want to make certain that the patient understands that if somebody is really coughing all over you and they don't have a mask on, move away or step aside. And if you're sick, please stay at home. Don't go to work or school. Isolate yourself. Home isolation is very effective from spreading the virus all over Guam. So those are things that we ask. We also provided all of you with this fact sheet, and we also provided the different partners that we've attended to who were with us in our sessions. And I'm going to go back to your question regarding isolation. I didn't forget. So part of that meeting that we had with SDA Clinic and FHB and Guam Regional Medical City, GMH, and the other clinics in Guam was to give them an overview and give them the layers of protection and all that. What we also wanted to do was we wanted to prepare so that if the patient, we have an overflow, that patients meet all the criteria of CDC, that they have been to China or they have been exposed to somebody who is known to be exposed and they have respiratory illnesses, then of course that criteria is met for both, then they have to isolate. There may be times where one area, such as maybe GMH or Guam Regional Medical City, may be overflowing, so it doesn't hurt to find out what our other counterparts, our other hospitals have, so that we can divert some patients to another area that has that capability. And so we did this discussion and we assessed all the potential facilities that have isolation rooms, and we also involved the military and Guam Regional Medical City in this picture. So those are things that we want to ensure that we have a plan of where to go should that overflow occur. We also assessed the fact that you have to make certain that your staff are all protected. Wear N95 masks, and you just don't wear that. You have to have a medical evaluation because not everybody can use it. And it's key to preventing the spread of this infection, especially to healthcare workers who have to take care of the patients. If you don't have your healthcare workers healthy, then you can't take care of the patient. And so doing that, and on top of that, we also emphasize that let's find out what resources are out there. So we want to know what personnel you have, what supplies you have, whether it's masks, gloves, face shields, Tyvek, PPE equipments, hand sanitizers, all that. So if we need to, share with each other, we have that ability to do so. And I also emphasize that all the clinics should start getting an inventory of all the supplies they have on hand and what they anticipate they will need, so that we're all prepared. We don't want to wait till the time comes. We want to be prepared. And so those are things that we discuss, and also equipment, and like oxygen tanks and so forth. So we just wanted to bring that to the forefront, and also improve on our communication as far as making certain that they get the latest information. And we realize that certain providers may not get the information, so we're looking at other avenues already. We've done that, assessing other associations and other boards, not just the health boards and the nursing board, but all the other 9 boards that are with the Health Professional Licensing Office. And in order to do that, we want to make sure there are other vehicles so that they get that information from public health. And we will continue to disseminate that type of information to the public.
And these precautions are for any respiratory illness.
That's right.
And reminding everyone too that so far, most of the cases of this virus are like the common cold. Most of them have been mild. And when we were looking at the numbers for the influenza on the mainland, it's 15 million cases, 25,000 deaths, and the death rate is looking like it's almost similar to this one. So not to minimize it, but with any respiratory infection, just use precautions. And I'd like to point out something else too that I really appreciate, and I would like all the clinics to be aware of that. A private clinic called, didn't get to evaluate the patient, said, hey, can we have your assistance? Case left the clinic, and we said, sure. So our team has worked all through the evening, and I was going through old x-ray reports trying to find any phone number, and we didn't know, but check it out. And they knew that they could call us, and our department would rally to the cause and help them. And we would invite all the clinics if you run into similar situations. Granted, the patient wasn't even evaluated, but they said, can you help us? Because he left the clinic or she left the clinic, and so we did. And so now we've had a good outcome, and the system worked. And it wasn't a case, but it was a good lesson for everyone on how ready we are and how much we're willing to help.
And again, I will close by saying we are aware of all the additional rumors and all these chat groups, and we want to remind the community that all this misinformation and rumors is really very dangerous. And so we want to make sure that we're at the forefront with public health to deliver to you the appropriate information as quickly as possible. And we've been very transparent, and you all know when you call me, I respond quickly. And so please rest assured that our team here of experts will do what we have, and we also have Dr. Thane Hancock as our CDC person, and he goes also above, and we have the CDC, we have the support from the Association of State and Territorial Health Officials by our side, including any other affiliation that we have with the federal government.
There will be more of these.
Yeah.
There will be more of these rumors going around, and even if it's not a case, we will react to the rumors, and it takes a lot of resources to do that. So we just
but we
use
want to be
caution.
safe. We want to be safe. We'd
Yeah.
rather be safe than sorry.
And there's
so
going to be more. This is just, it happens every time, and that's okay. We'll investigate.
right. Any other questions? Thank you to the
Thank you.
media.
Thank you all.
Appreciate it.
Yeah.
And there you have it, the press conference from the Department of Public Health. Just wanted to reassure the public out there that there is still no case of coronavirus on Guam. The earlier reports that came out about the patient who was seen at a clinic and who left before they could evaluate them and was reported to the public health. That was followed up on, and they were able to contact the individual today, and they were satisfied now that he did not meet the criteria for possible coronavirus infection, so that they are not pursuing the case any longer, and they feel reassured that there is, in that case, no coronavirus infection. There you have it from Public Health in Dededo, Nestor LeConte reporting.